Ethical and legal issues. Ethical principle in which autonomy, that means respect for an individual's right to self-determination, means autonomy, that means patient has the autonomy to refuse the treatment, to get the treatment, like that. And second one, that is non-maleficence, that means obligation to do or cause no harm to another. Remember that non-maleficence, that means no harm to another. We are bound by responsibilities, so we are not allowed to harm the patient, so that termed as a non-maleficence. Then beneficence, that means duty to do good to others. Yes, our profession is to help others. Our profession is allow us to help others, help the patient, to do good for the patient. So that is beneficence, to maintain a balance between benefit and harm. Then justice, equitable distribution of benefits, that means we have to do everything possible for our all patients, so that the another patient is not feel neglected, so that we are bound by the responsibilities, rules and regulations, that we have to we have to provide equal care and treatment to all the patient. So that is termed as a justice. Then veracity, the obligation to tell the truth, the obligation to tell the truth, that means if the patient has a terminal illness, so we are not allowed to say the patient that don't worry, it will be all okay. So tell the truth to the patient that your health is not good. So that is veracity. Fidelity, the duty to do what one has promised. If we have promised something to the patient, then we are bound by fidelity, that that promise will be fulfilled. Okay. The next one is ethical dilemma, that means conflict between two or more ethical principles. For example, remember that the patient has seizure and the patient is suffering from mental illness. So if the patient become too rowdy at that time, from protecting the other patient to from the that mentally ill rowdy patient, we are bound by the responsibility that we restrain him or her. But after that, after some time, patient suffering from seizure, so and patient get traumatized, and at that time, this is ethical dilemma. What should we do? We have to restrain the patient, or what to do? We are we are we are confused. So this conflict between two, that is, what should we do, restrain the patient or not to restrain the patient, this is called as ethical dilemma. This as a result of difference in cultural or religious belief. Okay, so that's all for ethical principles terms, that is autonomy, right to self-determination, respect for the individuals, and non-maleficence, duty to do no harm, beneficence, the duty to good I mean duty to do good to others, justice, equitable distribution of benefits, veracity, tell the truth, fidelity, the duty to do what one has promised, an ethical dilemma, that is conflict between two or more ethical principles. So we have discussed autonomy, non-maleficence, beneficence, justice, veracity and fidelity, and last one is ethical dilemma.